Dr. Lissa Rankin is a physician, speaker, founder of the Whole Health Medicine Institute, and a New York Times best-selling author. She has a medical degree and practiced following the principles of evidence-based medicine. Her own story and experience with patients made her look for new, radical ways of healing people. Seeing cases of spontaneous, unexplainable remissions, she started asking herself, what if we have the power to heal our body by changing how our minds think and feel? If the impossible happens to one person, is there anything we can learn from what that person did? Dr. Rankin started searching for hard proof to back her theory. Feeling she wasn't practicing the medicine she dreamed of, she left it and moved with her family to the country to live a simple life. There, she began blogging about what she missed and loved about medicine. She got in touch with a lot of people and read plenty of journal articles, trying to find out the truth about what happens when the mind is healthy and why we get sick when the mind is unhealthy. The book Mind Over Medicine records her journey of discovery and shares with us the scientific data she uncovered. We are halfway to 50,000 subscribers. Thank you guys for your ongoing support and encouraging comments. If you want to support us further, please check out our Patreon. It's highly appreciated and it helps us to keep creating amazing book summaries for you. Part 1. The mind has the power to change the body physiologically through a combination of positive belief and nurturing care. Dr. Rankin examines the placebo effect, explaining that the percentage of people in clinical trials get better because they believe they are getting a real drug or surgery. Researchers discovered that nearly everybody can be induced to respond to a placebo under the right conditions. Placebos don't just change how you feel, they change your biochemistry. There are different explanations of the placebo effect, but whatever the mechanism, it's clear that the mind and body communicate through hormones and neurotransmitters that originate in the brain, and then leave the brain to signal other parts of the body. Studies suggest that negative beliefs affect your health too. The more you focus on the ways in which the body can break down, the more likely you are to experience physical symptoms. Scientists call this phenomenon the nocebo effect. While the placebo effect demonstrates the power of positive thinking, the nocebo effect demonstrates the power of negative beliefs. Nocebo can result in sickness and even death when the patient expects such a result. When our beliefs are optimistic, the mind releases chemicals that put the body in a state of physiological rest, and the body's natural self-repair mechanisms fix what's broken. When the mind has negative beliefs, the brain recognizes these as a threat. They trigger the stress response. The cellular environment gets poisoned with stress hormones, and the body gets sick and has a hard time repairing itself. Because the conscious mind is functioning only 5% of the time, we must change our beliefs at the level of the subconscious mind. Our subconscious mind gets filled with beliefs we download from parents, teachers, and others who influence us early in life, filling our mind with programs that will run our life. These programs are usually written by the age of 6, so we should be careful about the way we program children. When Lissa Rankin talks about the body's ability to repair itself, she doesn't suggest that we should give up on the advances of modern medicine. She believes in the doctor as medicine. The doctor himself is the placebo. The personality of the physician makes a difference as well. Studies demonstrate that when the doctor treated the patient with warmth, attention, and confidence, the response to the placebo increased. It's because the stress response is turned off, the body relaxes, and can make efforts to heal itself. Nurturing care explains why many patients often experience remarkable results when treated by complementary and alternative medicine treatments, which include therapies such as acupuncture, Chinese medicine, homeopathy, Reiki, herbal medicine, energy medicine, chiropractic medicine, etc. The author often says that she practices love with a little medicine on the side. Part 2. The mind can alter the body's physiology based on the lifestyle choices you make. Dr. Rankin asks her patients not only about their past medical history, family history, medications, and history of substance use, but about the rest of their lives too. She had patients who were unhealthy because they were lonely or miserable in their bad relationships, stressed about work, worried about their finances, or depressed. The author is convinced that your lifestyle affects your body. In order to live a vital life, prevent disease, or optimize the chance for disease remission, you need healthy relationships, a healthy, meaningful way to spend your days, a healthy, fully expressed creative life, a healthy spiritual life, a healthy sexual life, a healthy financial life, a healthy environment, a healthy mental and emotional life, and a healthy lifestyle that supports the physical health of the body, good nutrition, regular exercise, adequate sleep, and avoidance of unhealthy addictions. The author believes that the body is a mirror of how we live our lives. The stressors of daily life make the lizard brain think you are under attack. It turns out loneliness can make you sicker than smoking cigarettes, where being part of a supportive community can increase your life expectancy. Many studies confirm that social ties and life expectancy are linked. Religious service attendance has a protective effect on life expectancy too. People who attend religious services live 7.5 years longer than those who don't. People with faith in a higher power are better able to find meaning in the face of loss or trauma. Happily married people have lower blood pressure and less insomnia. Lonely people have higher rates of heart disease, breast cancer, Alzheimer's disease, and suicidal thoughts. Loneliness leads to suppressed immune function. Creative expression is also good for your health. It releases endorphins and other feel-good neurotransmitters, reduces depression and anxiety, improves your immune function, and relieves physical pain. According to the author, happiness is preventive medicine and hope heals. Pessimists view the bad event as permanent, pervasive, and personal, which causes hopelessness and can spiral downward into depression. Optimists see bad events as temporary, specific, and external, and good events as permanent and the result of their own brilliance. Studies show that optimists catch fewer infectious diseases than pessimists, have stronger immune systems and lower blood pressure, live longer, and are less likely to suffer from cardiac arrest. Dr. Rankin points out that things like pessimism and optimism can be learned. According to the research, 50% of happiness is dictated by a predetermined genetic set point, 10% by life circumstances, and the other 40% can be influenced. She recommends meditation and keeping a gratitude journal every night as a way to elicit the relaxation response. Part 3. A radical new wellness model and the 6 steps of healing yourself. The tips the author provides are not just for sick people, but also for healthy people interested in preventing diseases. She believes that nobody knows the patient's body better than the patient, and that the patient is the best diagnostician. The 6 steps to healing yourself. Step 1. Believe you can heal yourself. In your mind, focus on what you want. Shift your beliefs and make room for the impossible. You never know what miracles might happen. Step 2. Find the right support. Find healthcare providers who believe in you and listen to the wisdom of your body. Step 3. Listen to your body and intuition. There are exercises which can help you tap into the wisdom of your inner light as it communicates through your body. Step 4. Diagnose the root causes of your illness. When you are experiencing symptoms your doctor can't diagnose, it's often because they are the result of repetitive triggering of the stress response. It's good if you can reduce stress responses and activate relaxation responses. Step 5. Write the prescription for yourself. Make a whole health treatment plan of radical self-care. You don't just obey doctor's orders, you become a full partner in the healing process. Consult with the best, but remember that they are there to serve you. Step 6. Surrender attachment to outcomes. It allows illness to be an opportunity for spiritual awakening. It is important to live in the present when you're going through a process like that. Remain optimistic, focus on gratitude, and appreciate what you have. Sometimes a cure simply doesn't happen. We must make peace with this fact. Whether or not you are cured, you will be healed, and your healing will offer a healing to others. If you enjoyed this video, you're sure to like our summary of Dr. Stephen Gundry's book, The Longevity Paradox. Thank you for watching.